Hello friends, welcome back. In this module, we shall be looking at how homeopathy can help the elderly. In the first lesson, we shall be taking a general overview. As you know, the elderly population in all parts of the country, in every nation, is rising. That is because we have a higher life expectancy, better standards of living, and better standards of hygiene, all of which have contributed to extended lifespans. But extended lifespans also bring with them considerable suffering and disease for the aging population. And that is where homeopathy has a tremendous contribution to improve the quality of life of our seniors. Some of the common elderly concerns which they suffer in their later years are listed here. One is absent-mindedness or loss of memory. It can be quite annoying for themselves and also for those around them. They also have problem with vision. It's not just short-sightedness or far-sightedness. It could be cataract or it could be further degeneration of the optic nerves or even cases of accidental damage to the eye as a secondary damage to falls and other such things. They also have problems with hearing, and worse, they have tinnitus, which is they hear some sounds, high-pitched sounds, which obviously are not there, but it's because of some form of degeneration of the nerves of their hearing system. Sleeplessness is another common problem. Sleeplessness is not just uncomfortable, it can contribute to ill health for the simple reason that the body does not get sufficient rest. Very often sleeplessness can take the form of not being able to go back to sleep in case they have been awoken in the night to go to the bathroom. Many of our elders are recovering from some form of surgery or the other, and they are bedridden and they suffer from bed sores. Once again, modern medicine has got very little to offer for recovery from bed sores. And a lot of them are coping with terminal illness, which brings with it not just physical discomforts, but also psychological problems. For all these and more, which we shall see shortly, homeopathy has a lot to offer. Continuing with some more elderly concerns, constipation is a very common problem for the simple reason that the large intestine seems to apparently dry out and there is no motility and the peristaltic action is weak. All these contribute to constipation, which has its own problems. Urinary incontinence, passing urine frequently or very scantily, has its own problems, and once again they are very peculiar for males and females. They also have a lot of issues with balance. It could be vertigo, dizziness, falls, and falls bring along with it other complications and suffering such as broken bones. A lot of them suffer breathing difficulties. They take longer to recover from respiratory disorders. Besides, they have issues arising out of loneliness, worry, and most of them are dealing with grief or loss of friends, of partners, and sometimes even children. Many a times parents outlive their children, and that can be very sad. As children, we have often done what is known as stippling art. We can create a whole picture or a portrait or a landscape simply out of dots. It's a lot easier today because we understand that pictures are made up of pixels. But even during my generation, we used to enjoy making stippling art, a series of dots, and everybody who was watching was wondering what that picture would come out to be. That picture in essence was in the mind of the artist. If you see these dots over here, they could probably make very little meaning. But if we see the larger picture, we'll realize they are part of the wisdom lines on the forehead of this wonderful, wise person. So whenever we are looking at our elderly, we have to take a holistic, complete view. Unfortunately, modern medicine looks at things in bits and pieces, much like Humpty Dumpty, which we have seen in one of our earlier lessons. Most elderly people are having comorbidities and they form a picture of totality. They tell the story about the person, his life experiences, state of physiology, and what is the care that is required. Diabetes, COPD, hypertension, fibromyalgia, anxiety, depression, hyperlipidemia, asthma, recovery from stroke, dyslipidemia, obesity, and so many other things go together. Are we going to give one medicine for each one of these? As a matter of fact, that's what. If you look at the elderly population, you will find that there is a lot of polypharmacy and they are overloaded with as many as a dozen medications. On the contrary, the aim of homeopathy is to find a single remedy. That's what we call as the law of simplex. It requires a little deeper analysis. It requires to understand the person at a deeper level. But let me assure you, it works beautifully. And that's what we are teaching in this particular course. Thank you very much for your attention. We shall see the next lesson where we'll deal with some evidence of how homeopathy is helping in the care of our elderly. People who raised us to be what we are today deserve attention and they deserve care and they deserve homeopathy. So once again, thank you very much and bye-bye.